Good evening, all distinguished speakers of the day and participants. And the topic today is misinformation during COVID-19 pandemic, ways and strategy to combat it. I am speaking uh, from my previous posting as a deputy commissioner, since we have seen this entire COVID almost two waves in the district. In that capacity, I think I can contribute for this topic. So before going into ways and strategy, just I want to define what kind of a misinformation we have faced as a bureaucrats, as an administrator, what was the challenge before us, so that I can share how we have tackled and how we have put effort and all. First, everyone faced the situation, but as an administrator, it was a uphill task for us, and we have to overcome that kind of a misinformation. First, about disease itself, many people question the COVID is not even a disease. COVID was not there. It's just a government is creating a scare. And about facilities in the institutions, government institutions, so many things were pointed out and exaggerated about such things, and misinformation about stealing the body or organs and all in that institution. Such kind of misinformation also, people, some rumor mongers spread it. And next, about some people who recognized this COVID, but came up with unscientific method to improve their immunity. Whatever the herbal items are there, they said, come up with videos saying that if you take this one, this will add to your immunity and all. Such kind of unscientific methods also was available. And next challenge was about vaccination. It was a big challenge. Many misinformation was created on the vaccination. These were all the issues we faced in the field, in the district level. Then ways and forward, I would make it as a two-part, how to handle this issue from the perspective of administration. One is that first you reach, before this rumor mongers goes with the misinformation, the authority in power and who is part of the system working and compacting this one, addressing the issue. You reach with the information first, so that the space available for the mischief monger and the misinformation would be reduced. Second is, second step would be actually fighting. Though you are reaching with the information, there are now, after the invent of social media and globalized world, now everyone become a creator of information. So those people also occupy, then you have to fight them. So first, reaching first, I would say it was very effective as a district authority in such a situation. When the curfew was imposed, everyone was looking for their district collector. Here in Punjab, it's a deputy commissioner. They were looking for the district collector. What is the information? What is the, how many cases was there and deaths and all? They were looking just what actions are initiated. So in Punjab, every collector has addressed daily briefing to the media, first about the cases briefing, so that right information of number of positive cases and all information goes to the people. And second, about actions taken on the day. It was every day one or the other order was issued to curtail the movements and control and improve the facilities, or open up the hoardings and all. That was shared with the people. These are all the decisions taken. And also, we used to touch one of the topics daily, facilities available in hospitals and all. Every topic we have picked. So basic thing I am trying to convey, the authority whom the people are looking, that authority should address daily basis. So even I came to know some of the persons who has good number of contacts has kept my video in their status also, just to make spread that message. Second one, local vernacular, uh, local well-known speaker, the voice common man regularly listen for any announcement. We have hired such person. So we made audio, whatever the order issued, order, government order, every people can't interpret it, common man can't understand it. To make them very simplified and understand to them, we made that recording from the known voices, and we made recording and sent the cycle rickshaws, especially to the lower income group area, so that the message will reach them, and we spread that information through various media platforms. This helped a lot. And there was one kabarnama written part. Somebody who is interested, we have taken a professor, retired professor. He is a good writer and used his service also to spread the message. And next, and good thing, we have involved in our deliberation meeting process. Daily meeting used to happen virtually. We have associated non-officials, especially social leaders who are visible and who part of our meeting, daily meeting process, deliberation process. The purpose of involving them, one is they can contribute also, and second, they listen what's happening. So at the end of the day, your task of spreading message come down, they carry the message. Instead of you create a statement, create and send it to media and all, those people already after the meeting is over carries that message, what's happening with the administrative station, what is the decision taken and all. So they were carrying the message about the actions, activities taking places. And we realized it's not only the big persons, like a celebrity status administration can influence the people, and actually the grassroots level officials also and the leaders can influence a lot. So we mobilized like revenue department, revenue patwaris, panchayat secretaries, and the Anganwadi workers. We have organized virtual meeting and trained them. Whether we have put actually information in their hand, so empowered them with the information, right information, so that they can become a messenger to carry the message. They have a lot of influence. We have unleashed that potentials. So and basically these officials, when the the number is huge, so first we have to convince them. The success lies when they are convinced to carry that message. Convincing them and giving them information, then they will take care of that one. That helped a lot. Next, we have utilized the leaders, various who has a good connect, social media followers and all, MLAs, ministers. We have shared all the informations about COVID disease spread, whatever information we were sharing, we were used that platforms, so that everyone visiting their pages can also see that one. And next one, we organized a separate virtual meeting, especially for these social leaders, NGO people and all. This will help them to come up with their queries. At the end of the day, everyone is human, and everyone will carry some kind of a doubts and issues and all. So we have asked them to express themselves, and we try to address through our healthcare officials and officers, administrative officers and all, just to empower them and associate them. They are part of the system, and so that they can carry and reach more people. So this is the way we have tried to reach people before this misinformation, these rumor mongers, so that our information will carry and cover first. Second aspects, once the misinformation is spreaded, especially facilities and all, especially about hospital facilities and all, there we have to tackle specific. We have put teams just to monitor different medias, what kind of message are carrying, taking out, understanding what kind of misinformation they have given. Then we have tried to find proper resources, anything regarding healthcare, saying that they are stealing body parts, kidneys and all. Then we have put two kind of approach for their well-known doctor who has an influence. We have asked them to address the issues. They came up with their own videos. And second one, we have asked the COVID patient who recovered, who actually stayed there in that facility, so that addressing, introducing themselves and reaching to the people. That small videos we have made and we shared with the people. Here also, in general issues, specific issues, we have come up with specific solution. General issues, again, we have asked about the people who has the influence in the social sphere also, or political leaders also come up with the statement. So that influences the people a lot. When assurance goes from a MLA minister, that makes a difference. So we have requested and we have utilized their contribution also. And when we have seen, when the leaders comes and gives a video, this is a one-way communication. Just you perceive something, this has happened, so you, that person is trying to address the issue. But somewhere in the grassroots and ground level, especially villages, people needs a discussion things. That is where we realize the grassroots officials and the local sarpanches plays a major role. So there two-way discussion happens. They address to the people raises the query in their own language, local vernacular way, so that these people try to address. That we have unleashed that one. We conducted a meeting with sarpanches, so that at the end of the day, sarpanch also a normal man, he will not have so much of information. So we connected with them so that they will raise those doubts here. So we officials of various discipline, we try to address their issues so that they can carry forward and curtail this misinformation, how to tackle that one. And actually that helped a lot. Many vaccine, even educated people were hesitant to go for the doses. The village people, it was a very uphill task. Some of the villages has achieved 100%. It's all because of empowerment of such a local leaders. One sarpanch told me how he addressed the issues. I asked him, he said that uh, simply they asked him whether he will take own responsibility, because you can't convince such kind of a people with a scientific thing. He said, I just said that I'm responsible for you and your family. That also worked. So that such way we try to address the issue. So I would say reaching first is the good way, and say to minimize the space for the misinformation, so that that would be a very less headache for the administrator. So whenever you find out such kind of a things, don't leave it. We have to address every misinformation, so that the right information would also be available at in the before the people. And finally, not least, uh, for an administrator, opening up mind, coming up with the strategies and devices, we need experts like a today's discussion and various. We also created a discussion forum, and Central University Batinda was kind enough to my request, and Dr. Rupalji was our advisor to our media panel. We engaged the experts also to guide us and devise our strategy. That helped a lot, come up with a proper strategy to handle the situation. That's why Muxar was one of the safest district in Punjab. We are able to curtail the diseases also, and able to put the system. And thank you for giving me an opportunity to present here. Thank you all. Thank you.